drive safely. And right now, welcoming, this is the right time. हमारे साथ डॉक्टर जुड़ने वाली हैं एंड वी आर टॉकिंग अबाउट ये एक फ्लू सीजन जो चल पड़ा है एंड डॉक्टर्स ने वार्निंग दी है क्लिनिक्स को हॉस्पिटल्स को बिकॉज दे आर सीइंग मोर पेशेंट्स विद फीवर कॉफ एंड फटीग के वो तैयार रहें. दिस इज particularly with families, older adults, and young children. So, flu cases are once again rising across UAE. Well, nothing to have fear of, but again, वो irritation, एक frustration सी हो जाती है that you're not feeling up to the mark. In fact, one of our dear colleague as well have been under the weather for quite some time. Neil काफी time से अच्छा feel नहीं कर रहे थे. I hope he's getting better now. So, without further ado, let's welcome हमारे साथ डॉक्टर हैं एंड म्यूरियल क्या नाम है इनका ये भी देखने की रेणुका रामास्वामी हमारे साथ हैं. गुड मॉर्निंग.
Absolutely. A very good morning to you, Doctor, and welcome to the show.
Good morning. Thank you for having me on the show.
Well, I think we are going to come with a barrage of complaints because most of our family members are down with the flu, very irritating cough, not knowing whether, it's a type of influenza, a virus, a bacteria. We have no idea. No medication seems to be helping. What is the way forward?
Of course. Even we have seen a very large cases of influenza, fever, flu these days. Especially after a break, the schools are reopened, so the kids are down with flu.
Especially when they are coming from, from their winter vacations, traveling around.
Yes. One reason is traveling, and the kids are going to school in the morning, very early morning, and the temperatures are really colder. So they are easily they are getting the infections, and the kids here now we are out of the mask as well. So when the kids are down with the flu, and they are supposed to keep them at the home actually, but due to the parents' work and all those environments, sick kids are coming to the schools, so the spread is very more. So we are seeing a lot of cases, and they take the infection home. Then elders at home and the sick people who have a lower immunity, they are getting infected. So we are seeing a surge of cases these days.
Dr. Renuka, now let's get started. Since you mentioned that temperatures in the morning are really low, is it because they are not well prepared? Because at times some are not wearing their caps, some might not be, wearing their inners to keep them warm. Is this also could be the reason, apart from infections that, you exchange while in the class from children perhaps who are sick or have been sick?
Yes, true, because they have to wait for their transport in the morning outdoors. So they are directly exposed to the winds and the cold weather. So this also can affect their immunity, and easily from the wind they can catch the cold.
Right.
So
Dr. Renuka, also if you could talk to us now, is the flu peaking right now? How severe is it? And is it too late to get vaccinated?
No, not at all. There's still room for the vaccination, because I think this colder weather will extend till April, and we can see a second surge of influenza B, mostly from February to April. So still we have time. So if somebody is not vaccinated, please get vaccinated. It will prevent from you to get complications of flu.
Who should be getting vaccinated, and who's allowed to get vaccinated, doctor?
Everyone after 1 year of age, we are giving the influenza shot. So, but people who are very immunity is low, like diabetes, older people about 65 years, and people with pregnancy, we are recommending to definitely get vaccinated. But there is no any exclusions. Everyone can get vaccinated.
So basically, if you are in the middle of the infection, then you should wait till you completely recover, and then okay.
Yes. If you are having any kind of flu or infection, it's better to wait for at least 2 weeks till you get your recovery. After that, you get your vaccination.
Right. Doctor, now please, if you could help me understand the difference between flu and cold, and are there any emergency warning signs that I must look out for? Say, heavy breathing, chest is aching, anything of this sort?
Yes, definitely.
Chest is aching, anything of this sort?
Yes, definitely, because flu is a very common symptom where everyone says I have flu. So flu doesn't mean that everyone needs to go to the hospital immediately. You can have a slight sore throat, a throat pain, or a runny nose, slight aching pains in your body, and you can take a paracetamol. So that will be fine. so you can take care of yourself. But if you are running a very high-grade fever above 39, 40 degrees, and you are coughing continuously, and your throat is like you are not able to eat or swallow, or you are having a shortness of breath, and you are continuously coughing with some sputum, these are some warning signs. You should immediately meet your doctor and do your checkup.
Dr. Renuka, when it comes to vaccination, are there side effects or, one might feel a little uncomfortable for a day or two, or it's going to be business as usual?
Influenza vaccine is not an live vaccine. It is an inactivated vaccine. So usually very mild side effects. Some people may get slight fever with as usual as all the vaccines, but very rarely we get any side effects.
And this should be annual or once in 2 years or perhaps?
No, it's an annual vaccine. We ask them to take it somewhere latter part of August or in the September before the winter season starts. It gives around 6 to 8 months of immunity, so it's an annual vaccine.
Now, before we let you go, Dr. Renuka, for people like me, not in favor of vaccinations, what would you advise when it comes to, good food intake or perhaps proper diet during this season?
Yes, definitely. That is, lifestyle measures are very important. You should have a good nutrition with proteins, vitamins, vegetables. It's a balanced diet. I would say it's a balanced diet. And you should hydrate yourself very well. And if you have any deficiencies like vitamin D deficiency or iron deficiency, please correct your deficiencies. An adequate sleep of 7 to 8 hours, which all maintain your immunity very well. So you don't have to take your vaccine, but still you can avoid the flu, I guess.
Fantastic.
Well, thank you very, very much, Dr. Renuka, for taking time out, having this chat with us, and hoping that we take a leaf out of our conversation today.
You're all over the place, by the way. I was reading your interview today as well. Well done, Dr. Renuka. Really appreciate it.
Thank you. Thank you so much.
You're more than welcome. Quite quickly, we're going to be moving into the sports update. We'll be back to share more news. Do stay tuned.
This is Fan Network News from the BBC.
BBC News with Paul Moss. The billionaire businessman Elon Musk has announced the merger of his space and artificial intelligence companies, SpaceX and xAI. He said the combined firm will work to install AI data centres in space where they could harness power from the sun while avoiding the expense of cooling. The former US President Bill Clinton and his wife Hillary, the former Secretary of State, have agreed to testify before the congressional investigation into the late offender Jeffrey Epstein. It came a day before a vote on whether to hold them in criminal